Hello, my name is Caroline Carey. I'm a data scientist at RTI International, and today I'm going to be talking about work done with Dr. Marcial, also from RTI, Silas from UC Berkeley, and our colleagues from RTI, Stephen Brown, Rob Chu, and Dr. Blumenfeld. So today I'm going to be presenting our poster on using query expansion to improve the findability of resources addressing multiple chronic conditions. So the focus of this research is on the resources made available through the Agency for Healthcare Research and Quality, so also called ARCS, publicly available domains. In particular, we were investigating the findability of resources referencing multiple chronic conditions. So chronic conditions are conditions like diabetes or hypertension, which are extremely common in American adults, and people can often be diagnosed with several conditions at once. And sometimes one condition can cause you to get another condition, and their treatments have to be made with all conditions in mind. So it's very important that providers and patients are able to access resources which address these conditions together. So ARC actually has several dozen individual domains, each with their own search appliances, and initial review, we found that it varied pretty widely on how easy it was to find multiple chronic condition literature in each of these domains. We decided for this poster to focus on one domain, digitalarc.gov, because of the large number of material we found to be available through the search related to chronic conditions. Since we were not able to gain API or database level access, we used web scraping to capture the search results and pull text from articles. So in this work, we're investigating how many articles we were able to find through basic search and then with query expansion. So through the basic search, we looked for each condition by itself and in combination. And so what that would look like is putting in the search for our chronic kidney disease with osteoarthritis, chronic kidney disease due to osteoarthritis, and other combinations like that, just to see how many articles we had returned. And next, we looked at manually creating lists of synonyms for each condition name using resources like the American Diabetes Association to find relevant terms. These would be general condition synonyms that someone might use when searching for one of these conditions, including more lay terms like high blood pressure instead of something like hypertension. Next, we established an automated process to search for related medical terms using the MESH API from the National Library of Medicine. And the advantage of this resource was that it gives us these relations like diseases or conditions which are related medically to a particular condition, and that allows us to find these very specific medical terms which might appear in an article, indicating that it is actually talking about the chronic condition, but it may not name the condition directly. So we use the algorithm in this bottom left corner here to search for a condition and then expand to include mesh terms that are related in these ways. So in this table in the middle, we compare the total number of articles that we found for each of these groups of terms. So when we just searched for the condition name, we found this many. When we added these synonym searches, and then when we did the condition names and these mesh terms. And so we saw that adding synonyms tended to about double the number of articles returned, and adding mesh terms tended to more triple or quadruple the number of articles returned. I will note that the mesh search did often find the same synonyms that we had already established manually, but not necessarily all the time, especially those terms which are more colloquial. And so to really find all of the articles that are related to a condition, one might want to have both a source of medical taxonomy and maybe a source of more folksonomy, which is more what just lay terms for different conditions that someone might use. So finally, what we did was we looked at the scraped text for ARC, and we looked at there's around 4,000 articles which could be returned through any search on that domain. And we wanted to look at it ourselves to see if we cleaned the text, lemmatized it, and then searched for these terms, what conditions did we find in these articles to sort of give us a more broad view of what articles we think should be returned for various searches. And we found some interesting disparities and also agreements in the articles that we found terms in versus the articles that were returned by searches. In the future, it would be really nice to be able to look further into what caused some of these differences. So while this poster focuses on expanding the number of search results found, we also hope in the future to move into organizing search results for maximizing findability and utility for users, because of course, having tons of articles returned is only useful in a way that if those articles are organized in a way that the user can actually make good use of them. So thank you very much for listening. Please feel free to email me at ccarey@rti.org with any questions.